Welcome to a conversation with Dr. Richard W. Fleming, world-renowned plastic surgeon. I think the first thing we want to focus on is the scope of your practice. Tell me a little bit about your practice, how long you've been here, and the type of surgery you do.
My practice has evolved significantly over the last 30 plus years. Initially, saw a lot of patients after trauma, did a lot of reconstructive work. However, now I've restricted my practice to primarily facial cosmetic surgery. It's all cosmetic, primarily facial. I've eliminated all body procedures. However, we do have other people in the clinic who in fact do the breast work and the tummy tucks and the body cosmetic surgery. It's a real misconception that the most popular cosmetic surgeries are breast augmentation and liposuction. While certainly a lot of that work is done, there's no doubt that the most popular cosmetic operation in the world is rhinoplasty. We all talk about the big Roman nose that's reduced, but that's a caricature because certainly that's done, but not frequently. Rhinoplasty surgery is about millimeters. It's about changing small things, finesse, either increasing projection, decreasing projection, or width. All of these things are individualized. So it's not about gross reduction. It's more about finesse and millimeter alterations, bringing all the parts of the nose into concert and proportional. The best sign of a good nose job is it looks totally natural and people are not sure whether or not you've had it done. That's the key. It has to look natural. I have a dear friend who's an internationally known chef, Tom Keller. His signature restaurants are the French Laundry in Napa and Per Se in Manhattan. When he's talking about his food, not just the content, but also the preparation, the presentation, he says it's all about finesse. Well, we can say the same thing about our rhinoplasty work. It's the fine points that make the difference. One of the biggest challenges we have with rhinoplasty surgery is not only are we dealing with form, appearance, the cosmesis, but equally important is the function. So when we're doing rhinoplasty surgery, we have several goals: either maintain or improve the function of the nose in addition to the cosmetic changes that we all see. Rhinoplasty is done by people of all ages. It's not gender specific. Both men and women have this done. Some rhinoplasty is done strictly for functional purposes, so that's another indication for this. Rhinoplasty is also done after trauma. And when you think about facial trauma, if in fact there is facial trauma, it almost always involves the nose, the central point of the face. So for all these reasons, rhinoplasty is in fact the most common cosmetic operation. The definition of a good nose, in one word, is natural. If somebody looks at you that you don't know and says, "I love your nose, who did it?" that's probably not a compliment.